Thank you, listeners, for joining us for Elko Live today. Today, we're presenting a program that we hope will help people in this time of distress and turmoil. A lot of people are feeling enhanced anxiety, and for any number of reasons. This is a very unusual time in the history of our country, and we thought it would be best to invite some guests who are professionals in this area. So from Vitality Unlimited Program Services, Vitality Unlimited here in our community, we have Vicki LaVersa and Marianne McCowan, and both these professionals have been on the radio with us before in reminding us of the significance of seeking mental health help and support when you need it. So welcome to both of you. Thank you for being here.
Thank you for having us.
Yes, thank you for having us, Lori.
So what we'll do first, just to let people know that you are both professionals in this field, you have a lot of experience, and you're living and working right here in Elko. Vicki, would you remind us of your credentials, please?
Well, I'm a licensed alcohol and drug counselor as well as a master addiction counselor. I have international certifications and across the country. I've been in the field for 30 years, working with mental health and substance use disorders. And I joined this after being a veteran in the U.S. Army. So that's something I'm real proud of and enjoy living in Elko.
Thank you, Vicki. We know that you enjoyed Elko. We've seen you out at numerous events, and it's also significant that you have a unique understanding of the perspective of military personnel and their families. Thank you, Vicki.
Yeah, you're welcome.
And Marianne McCown, Marianne and I have a special relationship in that we have both, we were reporters on the same beat often for, I want to say a couple of decades, Marianne, but you also have an amazing perspective in the community of Elko and in your own unique life experiences.
Well, I would say, yeah, I was a reporter for a couple of decades, and 15 of those right here in Elko. But also just having personal experience with different, I'm a domestic violence survivor, so having that lived experience.
Mm-hmm. And in your professional capacity now with Vitality?
In my professional capacity with Vitality, I do almost all of the outreach for our company and basically getting people the information of what services are actually available right here in the community, everything from mental health therapists to our substance use counselors. We have peer recovery support specialists, we have targeted case managers, and APRNs that can provide primary and psychiatric assistance.
And Marianne has gone out and accompanied these professionals in the VIP's mobile therapy van. So you have experience in the field as well, interacting with clients, consumers, people who have unique needs.
Absolutely. I mean, I'm the first person that a lot of times that people will come to and say, hey, I need this or need that. And I always have to remind them I'm not a therapist myself, but I do have some connections to get you in contact with some.
And sometimes that is the most important thing to getting the foot in the door, because it can be intimidating to hear, hey, maybe you should talk to someone, or have you ever thought about talking to a therapist? And some people say, no, because I can resolve my problems by myself. So,
or they're embarrassed. They're embarrassed because they're struggling. And I think one of the biggest issues is that stigma that gets connected for either co-occurring mental health issues or substance use. We don't like to admit that we've become vulnerable, or we're embarrassed or fearful of disappointing people.
And that's why we want to help break down those barriers and normalize getting mental help in any mental health help in any form that, of course, the VIPs can provide, or any of our other healthcare professionals. There are online services we know as well. So let's dive into this really current topic. And we know going into the holiday season as well, there are also different stressors. This time of year might be stressful if you're reuniting with family that you haven't seen and maybe you don't agree with politically. Unfortunately, it seems as though the election may have created even deeper division, but mostly fear. I guess that's what we're seeing even online. And
Well, I appreciate you saying that, because a lot of times what people do is mislabel our fear. We call it stress, we call it anxiety, we call it worry, we call it being overwhelmed, whatever vernacular we want to use, instead of being able to deal with the fear itself. And so what happens is the fear has a way of escalating with those disorders. And so if we were to begin to identify it correctly, then we can be able to develop and manage a plan. And I always say fear is the absence of a plan. And so as you showed us and as we've read, people are really fearful at this time. And they're fearful of the uncertainty of where life will take them. They're fearful of how they will be treated if they happen to be a disenfranchised member of a population. And so it can be really difficult. And so I say, let's stop for a moment. Let's just stop. Let's be human. Let's begin treating people as people. Let's show each other grace, which I think is very difficult at times, but also showing ourselves grace as we struggle through these times. And being able to say, what is my plan? What's going to happen if I have to address this? What is my plan for this? And what tends to happen when we change that thought process and get into the solution is the fear lessens. Doesn't go away, but it will lessen considerably. And I think that's really key.
There are groups in Elko that feel especially vulnerable because there was an overwhelming decision in the election, not just nationwide, but locally. And some of the comments I've heard from people are, I don't even feel safe walking through the grocery store, feeling like 3 out of every 4 people hate me, or because they may be LGBTQIA, right?
Absolutely. I think not only with this population, but people of color. Women, whichever party you may be a member of, it can be very frightening. And I would say one of the things in kind of restructuring our framework would be maybe very difficult at times, but it's not so personal. Even though it's coming at us and it feels really personal. And that's really difficult to say, and it's very difficult to kind of manage. And I would say, of course, I think in this time, regardless of where you are, we need to be vigilant of our surroundings and be cognizant of what's going on around us. But also think, wait, maybe this isn't about me. Feels like it, but maybe it isn't. And then what do I need to do? What is my plan? How do I develop safety plans? How do I be aware of my surroundings perhaps a little bit more? How do I seek out support? Now, I have to say I got a text not too long ago. There's a group of therapists that are doing a Zoom phone call kind of a thing. Let's talk about how to help people who are really struggling when we may be struggling as well during this time. And so there really is a lot of resources out there that's available, and Vitality Unlimited is a great one in which you can reach out. We will help, we will assist, we'll help you navigate these difficult times. Doesn't have to be a lifelong decision, it just can be a short, brief period of therapy or counseling.
Just checking in.
Just knowing that we're there and available. And support groups, a lot of things online as well.
So is it fair to maybe compare this time or this holiday season to, and again, the thought of, talking to some people, is it fair to compare it to like the stages of grief? I mean, I've heard a lot of people talking about that lately.
I would say so. There was a lot of hope with this election of the way people thought it may go or how they wanted it to go. And so I think a lot of people became very disappointed. And I think there is a grief, part of it is anger, but some people just jumped right to sadness and
despair.
Just the not knowing where to turn. I had a number of people just saying, I just can't do today. I just can't. And that can be really difficult, not only to hear somebody's and such turmoil, but what do you do with that? And so it's a difficult time. I think it's the collection of the election, the holidays coming up, the economy, the cost of living is extraordinarily high. There are a lot of things that are going and playing a role into this.
People are feeling vulnerable right now. Talking with Vicki LaVersa and Marianne McCowan. There's also another side to this too, in that we have friends and we have people listening to this program who say, I feel fine. I feel optimistic. I'm confident. I'm happy with the outcome of the election, right? And maybe I mean, could it be, what's the level of sensitivity? Or, I mean, how do we include everybody, right?
That's a difficult question because I think, this is where grace, I'm always concerned of the gloating winner. That's always a concern for me. And I think we can win with grace and we can lose with grace. And I think it's really about having the opportunity to say, wait, some people are struggling. And I want to be available for them because there may come a time where I'm struggling. And I would like as much help as I possibly could, regardless of any affiliation. We're humans first.
So it's important to acknowledge the struggle, to validate it, to accept it.
Absolutely. We can't resolve what we don't recognize. We cannot change what we don't see. So the first step would be just stopping, would be, what am I feeling? What am I thinking? What is happening? And then once we're able to recognize and become aware of it, then we can begin to develop that change plan. But it is a grief in some aspects. It really is a loss.
And we should talk more about that too, forming that plan and moving on, and talking with Marianne McCown too. And Marianne, you've been listening intently and probably with great understanding. And we want to assure people listening that they can access services. You don't have to have, elaborate insurance plans. I mean, people are always worried about, as Vicki said, I mean, the economy is a worry right now, having insurance or money to access mental health help.
Well, fortunately, Vitality takes Medicaid, Medicare. We take most private insurances, but also we have a sliding fee scale. So that hopefully would alleviate people from that stressor, because I know it's stressing for me whenever I go to the grocery store and that bill is $200 or more. When a couple years ago it was not that much. So yes, anytime that somebody needs services from us, there's various ways that you can get services from Vitality. And if they have any questions, I'm actually going to be at Fish tomorrow from 1 to 3 in our mobile therapy van. So if somebody wants to get some more information about the services that we provide and what's available and how the process works, because it's not as simple as going into an urgent care and just going in and saying, I have a runny nose and a cough, and can I see the doctor? There is a process that you have to go through so that we make sure that our providers make sure that they give the necessary services to provide to any of the clients.
So that'll be on Friday, November 8th, 1 to 3 p.m. The mobile crisis van will be set up at Fish. They're at 821 Water Street, and you can just mosey on over and introduce yourself.
Anybody can come on over, and I've had plenty of people, everything, they've come over, hey, I want services, to, hey, do you have any food? And we've handed out bags of food and bags of, whatever happens to be on hand, toiletries. I've had people ask me about housing, because that's the other it's so difficult in this town to find affordable housing. And that's another service that Vitality also provides to the community, is affordable housing.
Really? And that you did just celebrate the opening of your women's shelter, right?
Well, and our women's residence, we just had our open house, basically, to show people what the ARPA money was used for, because the city was very generous in having us be one of the recipients. But the women's residence is connected to our Vitality Center. So the women who are going through residential treatment at our substance use disorder treatment, they spend their nights at the new women's residence. So, and it was really nice to see some of the neighbors, especially we have a dentist's office that's right next door, and they were really worried about us going in at first. They thought that it would get really congested and it would be busy. And they're like, we didn't even know you guys were really open. You're so quiet. So that's always a nice thing to hear, and they were really impressed with the house and how it looks. I think it's a wonderful house. It's nicer than my house. So.
It's making a nice difference in the community. And we're continuing our discussion with Vicki LaVersa and Marianne McCown from Vitality Unlimited Program Services in our community, talking about the anxiety that we're working through as a community and as a country, and how people can seek help. And, Vicki, it occurred to me that we might need to remind folks of maybe some warning signs, maybe when things get to be too much. I guess the general hope is that after a few days, we'll be able to deal with the reality of things and be reasonable, as you said. I mean, work on our fears, certainly, own those fears, but then come up with plans, as you
Absolutely.
described.
I think, at first, whenever we hear some news, there's always a level of denial, and then we could begin processing. And I think that some people are experiencing that and are having difficulty with that. And so once that subsides and they've come to a place, some of those warning signs that really indicate maybe we're having a complicated grief cycle, for lack of a better phrase, would be, difficulty sleeping, maybe difficulty eating, or sleeping too much or eating too much, and signs of depression and losing the ability to enjoy things, what we used to enjoy, and increased fear and things like that. So we start experiencing some of those things, then I think we can start kind of being able to get into the solution. And some of the solutions, and one of the biggest thing is, we can always practice mindful and relaxation techniques. We can do deep breathing exercises, deep muscle relaxation. We can also limit news and social media exposure. I think sometimes we can become glued to things. And one of the biggest things, and I remember this so many years ago with 9/11, is we were glued to the TV. And then we began becoming overexposed, and we became, in some aspects, began traumatizing ourselves by this. And I just go like, okay, no more TV. We're going to turn off the news, And so I think really limiting what comes in makes a big difference. And then we have to be able to go, let's develop a healthy routine. What is it that we need to do? We're going to get up in the morning, we're going to eat breakfast, we're going to shower, we're going to go to school, we're going to go to work. We're going to be safe. We're going to take these things serious if we need to. The other things, if they're not, then we'll just let them pass. And then we'll be able to connect with supportive people. I think that's really what is so important, whether it be friends or families. Maybe this is an opportunity to rejoin families that may have been separated. But don't put too much pressure on yourself to do so. One thing at a time, because you may open a can of worms too. And so connecting with people, I think, is so important.
Taking care of yourself. We've also heard some stories from the community about children, how children are reacting to this news, Vicki, and how maybe parents are either exacerbating these problems. How do we help families? How do we help children?
Well, I think we sit down and we have a very candid conversation with them that is age appropriate, and be brutally honest in some aspects. That can be really difficult.
If you're a child, say, of immigrant parents, Vicki?
Absolutely. I think, how do we teach our children to be safe? I would even say not necessarily immigrant parents. How do we teach our children to be safe, period? But, I think there are some things that, in regards to immigrant families that may be experiencing the same as people of color, same as LGBTQA+, they're going to be experiencing some very difficult times, perhaps, and there's a lot of fear there. And I would say, let's just take one day at a time. Let's just take one moment at a time if we need to, and be able to then gather our troops, for lack of a better term, and say, what do I need to do to help? What do I need to move my family forward? But it starts with that brutally honest conversation. Again, I caution about age appropriateness. We're not going to tell a 4 or 5-year-old the same thing we may tell a teenager. Mm-hmm. And so we have to be able to really gauge. And we know our children. We know what they need to hear. They know what, and they're hearing things themselves, And
seeing things on social media. Right?
Absolutely.
Mm-hmm.
And so it's okay to say, we can disagree with family. We don't have to have the same goals and desires and same thoughts, but we can still honor them for who they are and what they mean to us.
That's a really good point. I guess that defines compassion in a way, right? Because compassion is the ability to try to put yourself in someone else's shoes.
Absolutely. And I think this societal pressures of divide has really been created for so many different reasons. And I think we just have to really identify what do we value. And if it's continuing with these relationships, then we continue with the relationship. Or if the relationship has changed, how can we continue with a relationship that's changed and just have it maybe be different?
But you can still love your family members.
Absolutely, as we would hope they would love us.
Mm-hmm. And you're probably going to hear, as you go out and about in the next several weeks and months, and who knows, even years ahead, and hear stories about families, people who become estranged. And then at the same time, there may be stories of people who are able to reunite. I mean, I think, Marianne, there are probably families all over Elko County that have had deep differences. Some of them may be generational.
Absolutely. I was telling Vicki earlier, I went and visited my family in Texas and for a big wedding, and we have certain people in the family who have very strong views one way and certain people who have very strong views another way about a lot of different things in life, not just politics. You find those common things that you are all joyful about. And we were all so overjoyed to be at a wedding and seeing our family grow and getting to see nieces and nephews, or now I have grand nieces and nephews that I hadn't met. I'd only seen them through Facebook, and here I'm getting to see them in person. So I keep telling people, find your joy, find those joys in life, and that helps when I've lost family members or had anything really horrid happen. You kind of have to seek out the joy. Stop seeking out what's making you miserable and start seeking out what's going to make you joyful.
Oh, that's wonderful. Those great words, Marianne. And Marianne and I we get to participate in joyful things, and sometimes it means you find them in the community, the common things, because we both like theater. And so we've been able to do that. We've been backstage for many hours, Marianne. That's not our blood relatives. Those aren't our aunts and uncles and cousins and siblings and parents, but you sort of make a family. We don't want people to be alone, especially if they're in crisis, right?
Absolutely. I definitely refer to my theater family. It's not my theater associates, it's my theater family, because you get to know people in a different way. But even I was telling a coworker, we both play World of Warcraft, and I said, you know what? Let's go kill some dragons. And that's a different way to hang out. So there's so many ways that we can find joy in life. And I see myself sometimes, you get down that rabbit hole of, I can't go home for Thanksgiving, or I can't see my family for Christmas. And then I just start seeking out miserable things. And I have to stop myself and say, nope, I'm going to seek out what is going to make me laugh and be joyful. And it always brightens the mood.
Well, and that's the other thing too. The group that you may seek out, Vicki, you're not going to agree on every common thing. I've sort of found this out too, even during the stressful times, whether it's immediately following the election that we just had, or certainly in the weeks and months ahead. There's kind of an echo chamber that you create if you just want to, seek out people that feel exactly the way you do. I had my finger poised to unfriend or unfollow, whatever it is that you do when you're like, I can't believe they said that or did that. And then I thought, I'm going to do something different. And so I reached out to them in a personal way, and that person said, I'm so glad you reached out, because I'm confused and I don't know how to support people because I'm happy with the outcome, right? And so then I was able to have a constructive conversation. Like Marianne was saying, you find what's common, what you love, and then you say, okay, sounds like you understand me. I understand more about you. I may not agree with you. I'm still heartbroken. But rather than just deleting that person from your life, you kind of built a little bridge or a footbridge.
Well, I agree. I think it's very easy to throw things away. We've become a very disposable society. We have water bottles, we have disposable diapers, we have all these things. And unfortunately, it's kind of transitioned over to disposable people. And I don't think that's the answer. In fact, I know it's not the answer. And so I think what that really speaks about is the care and concern and love for this person that you had, that you reached out and said, I don't want to do this, because that divide, that unfollow, that unfriend, that delete is what's going to continue with the divide. So you took a step to really kind of bridge that gap and save this friendship or whatever it is. And so I commend you on that. But I also think that's how we do it. We have to reach out. We have to support each other. We're not going to agree on everything, but we have to be able to say, I respect you and I understand it. We don't have to agree, that agree to disagree. But as an individual, I encourage you the power to do that,
And then, Vicki, we also want to just bookend that with the topic, too, of toxicity, I guess, or toxic relationships. Sometimes there does come to a point where you just have to say, no more, right?
Absolutely. I think, but there's a time when we set boundaries. And I think that's where it is. And so we have physical boundaries, we have emotional boundaries, we have spiritual boundaries, financial, intellectual. We have tons of boundaries. But people don't know what our boundary is. And if you ever want to test that out, go to a grocery store. And when you get clipped on the heels with a cart, they've crossed your physical boundary. But people don't intend to. And I truly believe that people, for the most part, are good-natured and maybe I'm naive, but I choose to believe that. And that they're not wanting to hurt or harm anyone. They just don't know that it is. So one, you have to inform them. Again, they can't change if you're not aware of it. And so whether the boundaries for them, whether they adhere to it or not, doesn't matter. But you are advocating for yourself and you're setting that boundary. If the person continues, after numerous discussions of those boundary crossings, to continue to do so, then I suspect you need to reevaluate just how important this individual is. And where you may decide, let's take a break.
Marianne, are you thinking thoughts, too, that you'd like to share? We appreciate you being here.
I guess I see it a lot just for years of covering crimes and other things. You can't control anybody but yourself. So, I think sometimes we get wound up in, well, I don't like how they're reacting or how they're doing something, whether they're really happy about something or not, or they're upset about something. You can only control how you react to things, and you need to focus on how you're going to react and setting those boundaries. If you set a boundary and then a person violates that boundary, okay, are you going to let them keep violating the boundary, or are you going to back off? Taking it one step at a time and focusing on what makes you joyful. Stop digging your heels in and keep re-traumatizing yourself. From a layperson standpoint, you re-traumatize yourself. It's not helping you. It's not helping you get anything done. And talking to somebody who may, again, going to see a therapist, going to see a counselor. If you're having issues or feelings or thoughts that you're having a hard time dealing with, going to somebody who's not going to judge you, who's not going to tell you that you're not reacting the right way. Having somebody who's going to be there to actually give you a challenge and true assistance, not just, okay, great, you're going off on a tangent, go away. That's, have those people available at Vitality. You can come and, make an appointment. And there's lots of different ways. Or reminding people. Let's say you do come across somebody who is just distraught and you don't know what to do. Remind them of the different numbers that they can call. Tell them to reach out to somebody. I still run into people in the community that do not know 988 is available. If you come across somebody who is overly distraught, you don't have to call 911. You dial 988, and then you'll actually get to a mental health professional or a counselor or something. Not every time that somebody is distraught, they don't need law enforcement showing up for that or an ambulance. Sometimes they just need somebody to talk to.
And you will get that real live person on the other end, Marianne.
So expectations, I think we have to learn how to manage those a little bit more effectively. If I don't have expectations, I tend not to be disappointed. That doesn't mean I have my own standards, but when I put those standards on other people, they become expectations. Let's reevaluate how we do things. And is this the time for change? This could be a wonderful opportunity to change. I think it's at times where we struggle the most is where we begin the most healthy journey. When we're reaching out to these people, let's not use one broad brush to paint everybody. I think it's really important to take individuals as an individual. Everybody has their own journey. One of the biggest things that I hope we're able to pass along is that you're not alone. You're not alone. There's help out there. There's connection. There's groups. And I really encourage all of you to reach out to someone, because one of the most difficult parts in life is suffering in silence and suffering and being alone. There are people out here that genuinely care and want people to do better and want people to do well. We call it weller than well. They recognize that there is need and they get well. I just encourage people to reach out, not to suffer in silence. For those of you who are happy, congratulations. For those of you who aren't happy with the way things turn out, maybe it's just another opportunity to look at what needs to be done and do what you need to do for you.
You can call Vitality Integrated Programs 775-777-8477.